All new here at 10. Tomorrow is recognized as National Rural Health Day, honoring the dedication and resilience of rural health professionals, organizations across communities nationwide. Tonight, CBS 19's Robert De La Garza shows us what East Texas is doing on their part to ensure families are covered throughout the Piney Woods.
East Texas is a patchwork of cities, towns, and rural pockets. Tyler and Longview serve as major medical hubs, but venture just a little further into the Piney Woods, and access to care can quickly disappear.
It doesn't take getting too far out from those major population centers where we start to see a real limit to the number of physicians, the number of nurses, to the number of urgent cares, to the numbers of medical facilities to treat patients.
Paula Anthony is the Chief Strategy Officer for UT Health East Texas. She says the shortage can have real consequences. And Northeast Texas has some of the highest rates of chronic disease, heart disease, cancer, and stroke in the state.
The real issue is that it's not just that it's inconvenient, and the financial issues are very serious, but it has a real consequence to health.
To address the challenge, UT Health and Christus are focused on retaining local students, training them in East Texas, and retaining them to serve rural communities.
We want to recruit the best. We want to partner with all the institutions to make sure we have access to the best. We want to get them here, and we want to keep them here.
Programs at UT Health and Christus help students train in local hospitals and clinics, hoping they build their careers right here.
5 years ago, we had 30 residents that were training in East Texas hospitals and clinics. Today, 230, with a plan to grow to 330 plus.
But access isn't just about doctors, it's about facilities. SVP of Christus, Chris Glennie, says they've invested nearly $1 billion to build facilities in these rural pockets, including hospitals, emergency clinics, and micro hospitals to bring care closer to home.
You know, we want people to stay in Northeast Texas for care. Frankly, we want people to stay in their communities for care. And so we really want to invest in these more rural communities to make sure that they have the care that they need.
Telehealth and virtual care also play a growing role, connecting patients in small towns to specialists without the long drive.
Okay, but I'd say within the next 5 years, more and more care will be offered virtually, and more patients will take that as an opportunity to seek care where travel becomes difficult.
By investing in people, facilities, and technology, East Texas hospitals hope to make healthcare accessible close to home, as it should be. Reporting in Tyler, Robert De La Garza, CBS 19.